How to survive a heart attack alone. 7 instant tips. 10 golden mins. Every senior must know. I truly hope you never find yourself in this situation, alone, clutching your chest, wondering if this is how it ends. But let's be honest, prevention is always better than reaction. In the United States, someone experiences a heart attack about every 40 seconds, and nearly half of those events happen at home, often when help isn't nearby. It's a chilling thought, yet it doesn't have to end in tragedy. Because when you know exactly what to do in those first few seconds, you give yourself a fighting chance. And knowledge is the most powerful medicine you'll ever own. These simple science-based actions can keep blood flowing to your brain and heart until medical help arrives, and they can literally make the difference between life and death. But before we get to these 7 instant life-saving tips, there's something even more critical. You need to recognize the warning signs early, the subtle ones most people ignore, and act within what doctors call the golden minutes. Because when your body sends the alarm, every heartbeat counts. Most people who die from a heart attack never make it to the hospital, not because help wasn't available, but because they waited. The average delay before calling 911 in the US is over 2 hours, according to the American Heart Association, AHA 2024. But the truth is harsh. Your first 10 minutes are the golden window that decides if your heart muscle survives or dies. Every minute that passes without oxygen kills roughly 10 million heart cells. That's why hesitation is deadly. The signs are not always dramatic. Many seniors mistake early heart attack symptoms for fatigue, gas, or stress. But here's what you must recognize: a heavy squeezing pain in the chest that doesn't go away after a few minutes, spreading to your arm, back, or jaw. You might feel sudden shortness of breath, cold sweat, or unusual dizziness. Sometimes there's no pain at all, only a deep feeling that something isn't right. Women and people with diabetes often feel it as nausea, jaw tension, or tightness in the upper back, not classic chest pain. These are still red alarms. The rule is simple. If it feels different, stronger, or stranger than usual, act. Don't wait for it to pass. Don't convince yourself it's just indigestion, because once the heart stops, even the best doctors can't turn back the clock. When you sense these signs, your survival starts with your first decision: to take it seriously. Then move fast. 1. Sit down immediately. When a heart attack hits, it often comes like a thief: a sudden pressure, a crushing pain in the chest, or a strange tightness that creeps into your arm and neck. Your instinct might be to move, to reach for something, to stand up in panic. But that's exactly when the danger multiplies. The heart, already starving for oxygen, must not be forced to pump against gravity. Sitting down right away is not weakness. It's survival. Lean your back against a wall or a firm chair, bend slightly forward, and let your arms rest on your thighs. This simple act can reduce the heart's oxygen demand by nearly 20%, according to data from the American Heart Association, AHA 2023. In those first seconds, you're buying time for your heart muscle, slowing its struggle for breath. Many seniors don't realize that lying flat can actually trap blood in your chest and strain the heart even more. That's why sitting upright, slightly leaning forward, helps the lungs expand and improves blood return to the heart. If you feel faint, that position prevents a dangerous drop in blood flow to your brain. It's a small adjustment, but it changes everything. And here's the crucial tip: never try to walk or shake it off. The moment you sit, plant your feet, breathe in slowly through your nose for 4 seconds, then exhale for 6 seconds. Do it 3 times. It's not meditation. It's control. It's telling your body, I'm still here. I'm still fighting. Every heartbeat saved in that first minute can make the difference between collapsing alone and surviving long enough to be found. 2. Call for help. If your vision blurs or your speech starts to fade, don't waste energy trying to find words. Tap your phone, dial 911 or 119 and press the speakerphone. Just having that open line could save you. Emergency operators can trace the signal within 90 seconds in most areas of the U.S., according to FCC Emergency Response Data, 2024. That trace could mean the difference between life and death if you lose consciousness. So don't hesitate. Hit the number first. Words can come later. If you live in a rural area with weak signal, send a short text that says, "Heart attack, help" to your nearest contact before you call again. Keep that message saved in your drafts so you don't have to type it under pressure. You'd be surprised how many lives could be saved by a prepared text. And remember this, keep your phone nearby, not across the room, not on a charger in the kitchen. Seniors who keep their phones within arm's reach at all times are 2.5 times more likely to reach emergency services in time. That's not paranoia, it's preparation. Once you've called, don't move. The call itself is your lifeline. Stay calm and focused. Listen. Even if all you can do is breathe near the microphone, that sound tells rescuers that you're still alive. 3. Chew a full-strength aspirin. Now, this is the one step that truly changes outcomes. If you're conscious and have access to aspirin, chew one 325 milligram tablet immediately. Don't swallow it whole. The chewing action lets the medicine absorb through the soft tissues of your mouth, cutting the time it takes to thin your blood by more than half. According to a clinical review by Harvard Medical School, 2022, chewing a single aspirin within 5 minutes of symptom onset reduces death risk by up to 23% during a heart attack. What's happening inside you is a war. Platelets clumping together, blocking blood flow to the heart muscle. Aspirin interrupts that chemical chain reaction fast, but only if it reaches your bloodstream fast. If you only have 81 milligrams baby aspirin, chew 4 of them. They'll do the same job in about the same time. And if you're unsure whether it's really a heart attack or just indigestion, take it anyway. Unless you have a known aspirin allergy or recent stomach bleeding, the risk of delay is far greater than the risk of one tablet. Here's the insider tip that most people never hear. Keep one aspirin tablet taped under your phone case or in your wallet, somewhere you can reach it instantly, even in bed. Time is muscle. Every minute lost means about 10 million heart cells dying. That's why the single tiny tablet has saved more lives than any machine ever built. 4. Stay still. When panic sets in, the body wants to move. But movement is your enemy. Every step, every climb, every effort multiplies the oxygen demand of your heart. It's like asking a drowning swimmer to sprint. The less you move, the more you survive. Staying completely still keeps your blood pressure stable and gives your heart a fighting chance to restore rhythm. Research from the National Institutes of Health, NIH 2021, found that even mild activity during a cardiac episode can raise mortality risk by 35%. That's why the best thing you can do is absolutely nothing. Sit where you are. Breathe slowly. Count your breaths if it helps. If you feel lightheaded, brace your body with one hand against the wall or floor to keep blood flowing evenly. Don't try to lie down flat, and never attempt to drive yourself. Too many seniors lose their lives because they believe they can make it to the hospital. Your car can become your coffin if your heart stops mid-drive. Here's a subtle but powerful trick. Tilt your chin slightly downward when breathing. This keeps your airway open while reducing the strain on chest muscles. It's a small posture adjustment, but it helps your lungs fill more evenly. At this point, every second of stable oxygen counts. Staying still isn't helplessness. It's control over chaos. It's how survivors buy their next minute. 5. Cough only if you feel faint or your vision dims. If your vision starts to blur or you feel like you're slipping away, your heart might be losing rhythm. In that moment, your brain isn't getting enough blood, and you have only seconds before you black out. When that happens, start coughing firmly every 2 to 3 seconds. Not a weak cough, but deep, strong, steady, like you're trying to clear something from your chest. Each cough pushes pressure through your chest and squeezes blood toward your brain and heart. It's a natural pump, your last way to keep circulation moving until help arrives. The European Society of Cardiology, 2020, found that controlled coughing during sudden cardiac rhythm loss can help keep a person conscious in 60% of cases long enough for emergency responders to arrive. The air you push out builds chest pressure, which forces blood through the heart and back to your brain. Here's what to remember. Start coughing only if you feel yourself fading, not for mild pain or anxiety. Coughing too early can strain your chest, but if darkness starts to close in, it's your last line of defense. Breathe in once, cough hard from your diaphragm, then repeat every 2 to 3 seconds. Keep the rhythm. It's painful, but it can keep you awake and breathing. This action gives your heart a few more beats, just enough to stay alive until someone reaches you. 6. Loosen anything tight around your chest. As the pain continues, every inch of tight clothing makes it worse. The chest expands with every breath, and when something squeezes it, a belt, collar, tie, even a fitted shirt, your lungs can't fill properly. That traps carbon dioxide and forces your heart to work harder for air it doesn't have. So the next move is simple but critical. Loosen everything tight around your chest, waist, and neck. Undo your collar, loosen your tie, take off your jacket or belt if needed. If it's cold, cover your shoulders lightly, but don't let anything restrict your chest movement. The Cleveland Clinic, 2022, noted that shallow breathing caused by chest restriction can reduce oxygen levels by up to 15% during cardiac distress. That's the difference between staying conscious and passing out. Once you've loosened up, sit forward slightly. Breathe in slowly through your nose for 4 seconds, then breathe out through your mouth for 6 seconds. Keep counting in your head. 4 in, 6 out. This rhythm balances oxygen and calms the nervous system. It lowers adrenaline, which helps your heartbeat stay steady. If you start to panic, place a hand gently over your chest and feel it rise with every breath. You'll notice the air moving easier now that nothing's pressing down. That's your oxygen working for you. You can't stop the attack, but you can help your body fight smarter. 7. Make yourself findable. You've done everything right so far, but now you need to make sure someone can reach you. A heart attack is a race against time, and being found quickly is half the battle. If you're at home, unlock your front door right now. Turn on every light near the entryway. Leave your door slightly open if it's safe. Place your keys or phone where rescuers can see them easily. If you collapse behind a locked door, paramedics lose precious minutes breaking in, minutes your heart may not have. If you're outdoors, move just enough to make yourself visible. Don't stand, don't walk far. Sit where people can see you, near a sidewalk, roadside, or under a light if it's dark. If it's daytime, find shade to prevent overheating. Put something noticeable beside you, a red scarf, a bright jacket, even your phone screen glowing. These signals tell others that someone needs help. FEMA Emergency Field Data, 2022, shows that quick visibility increases survival chances by 44% in solo medical events. That number is huge. People often die not because help doesn't exist, but because no one knows they're in trouble. So remember, make yourself findable. Don't crawl into a corner. Don't hide your pain. Stay where rescuers can see you. If you have any strength left, tap something loud, flash your phone light, or call out once every few seconds. You don't need to shout, just make a sound. You've already fought for your heartbeat. Now make sure someone can follow that sound to save you. And before you give up, remember this. If you're still breathing, if you're still awake, your heart has not stopped yet. You are not gone. You still have a chance. Heart attack and sudden cardiac arrest. Most people panic because they think heart attack means instant death, like a light switch turning off. But that's not true. For most people, the words heart attack sound the same as sudden cardiac arrest. They are not the same thing. A heart attack happens when blood flow to part of the heart is blocked. The heart is still beating, but it's weak, starving for oxygen, fighting to keep you alive. In contrast, sudden cardiac arrest means the heart's rhythm has completely stopped. It's no longer pumping blood. That's when you need CPR or defibrillator right away. During a heart attack, you may have 10, 15, even 30 minutes where the heart is struggling but not yet stopped. That's your window, the time when every tip you've learned matters most. According to the American College of Cardiology, 2023, nearly half of all heart attack victims survive if they act within the first 10 minutes of symptoms. Half. That's not chance. That's action. So if you can still move your hand, call for help. If you can still breathe, Chew that aspirin. If you can still think, you can still live. You are not helpless. You are alive, and your heart is still fighting. Help it fight back. If this video could save even one life, make sure to subscribe, like, and especially share it with your loved ones. One share might be the reason someone survives those critical minutes when help hasn't arrived yet. And if there's a topic you'd like us to cover next, leave a comment. Your idea could help protect an entire community. While waiting for our next video, check out the one pinned on the screen. It'll show you more life-saving ways to protect your heart, no matter your age.